Janet is hearing more concerns about eating, feeding, and swallowing in the pediatric patients she works with. This is a complex area of practice, and Janet isn't sure where to find reliable resources to share with families and help her provide the best care. She'd like to feel prepared when she receives a new referral. Janet heard about the AHS PEAS website from a colleague. Pediatric eating and swallowing? This is exactly what she's interested in. Janet can see that the PEAS site has a lot to offer, and it's evidence-based, patient and family-centered, and focused on collaborative care. Feeding is a struggle for many of Janet's patients, so Janet notes that the Feeding Matters questionnaire is a good place to start. Back on the PEAS website, the Clinical Practice Guide stands out as a great source of information. It's searchable and full of evidence-based information and tools to support clinical decision-making. The Find Services page lists all of the pediatric eating, feeding, and swallowing services offered by AHS and how to make a referral. Under Tools, the Collaborative Goal Wheel and Feeding Care Plan are designed to improve communication with families, caregivers, and other healthcare providers. There's an equipment list that's easy to filter by age and needs, also important to share with families. The Community of Practice page is intriguing, especially for providers like Janet who don't work in multidisciplinary teams. Joining this community seems like an easy and important way to enhance patient care. There are professional development resources and aids to support collaborative practice. On the Family section of the site, there are numerous handouts for caregivers to reinforce the strategies they've been given. And the Family Life and Self-Care page shows there is support for concerned caregivers. Janet is excited to share the PEAS website with colleagues looking to support families who need eating, feeding, and swallowing services. Janet now has the AHS PEAS website to help inform the care she provides for her patients.